The findings, published in The Lancet, suggest that booster programs are necessary to help maintain protection from severe disease in those vaccinated with AstraZeneca. It is hoped that governments will be able to design booster programs that can ensure maximum protection is maintained, as studies are published. Researchers from Scotland and Brazil looked at data from 2 million people in Scotland and 42 million people in Brazil who had been vaccinated with the AstraZeneca vaccine. In Scotland, when compared with 2 weeks after receiving a second dose, there was around a 5-fold increase in the chance of being hospitalised or dying from COVID-19 nearly 5 months after being double vaccinated. Researchers say that the decline in effectiveness begins to appear at around 3 months. After this point, the risk of hospitalization and death is double that of 2 weeks after the second dose. The risk increases threefold just short of 4 months after the second vaccine dose. The study also looked at vaccine effectiveness at similar fortnightly intervals by comparing outcomes of people who have been jabbed with those who are unvaccinated. The study is part of the EVE2 project, which uses anonymized linked patient data in Scotland to track the pandemic and the vaccine rollout in real time. Professor Aziz Sheikh, director of the University of Edinburgh's Usher Institute and EVE2 study lead, said, "Vaccines have been a key tool in fighting the pandemic, but waning in their effectiveness has been a concern for a while. By identifying when waning first starts to occur in the Oxford AstraZeneca vaccine, it should be possible for governments to design booster programs that can ensure maximum protection is maintained. The popular food that quadruples the risk of dying from cancer, warning hypertension diet, the vegetable you should eat every day, advice, if eligible for a booster and you have not yet had one, I would highly recommend that you book one soon," the professor added. Professor Vital Katakareddy at the University of Glasgow also spoke of the importance of getting a booster dose. Our analyses of national datasets from both Scotland and Brazil suggest that there is considerable waning of effectiveness for the Oxford AstraZeneca vaccine, with protection against severe COVID-19 falling over time. The professor added, "Our work highlights the importance of getting boosters, even if you've had 2 doses of the Oxford AstraZeneca vaccine, as soon as you are able to." Indeed, the NHS explains that a booster dose of the coronavirus (COVID-19) vaccine helps improve the protection you have from your first 2 doses of the vaccine. If you're eligible, you'll be offered a booster dose at least 3 months after you had your second dose. If you have a weakened immune system and have had a 3rd dose of the vaccine, you can get a booster dose from 3 months after your 3rd dose. The health body states, most people will be offered a booster dose of the Pfizer/BioNTech vaccine or Moderna vaccine. This means your booster dose may be different from the vaccines you had for your first and second doses. Some people may be offered a booster dose of the Oxford/AstraZeneca vaccine if they cannot have the Pfizer/BioNTech or Moderna vaccine. The vast majority of the UK adult population has received a COVID-19 vaccine since the programme was launched. There are 4 common side effects, which are the same for all COVID-19 vaccines used in the UK. They include having a painful, heavy feeling and tenderness in the arm where you had your injection. This tends to be worse around 1 to 2 days after the vaccine. Some people will also feel tired, have a headache, or experience general aches, or mild flu-like symptoms.